Welcome back, everybody, to another amazing week here in Los Angeles, California. This is the Late Night Show with Dr. Kojo, and I'm your host, Kojo, checking in from sunny Los Angeles, California. And before we get into the topic, and as you all can see, we're talking about anxiety and a couple of practical tips on how to manage it. But before we get to the topic, I would love for you all to introduce yourself. Let me know where you all are checking in from, and then we can go ahead and get started on today's live stream. We got Cheyenne. Cheyenne, what's cracking? Cheyenne's checking in from Oregon. How you doing? We got YouTube Love. Mara, what's going on? Courtney says she's here for this. Courtney, I appreciate you. We got Washington in the house. I got Brian. What's up? We got Arkansas. Vanessa, how you doing? We got Georgia in the house. Hey, we got South Quebec. Canada in the house. Texas, baby. We got Minnesota, Asheville, North Carolina, South Carolina. All right, okay. So we have people from all over. Let's go ahead and get into it, right? So, as y'all know, I like to wear that shirt that says action defeats anxiety. And I do believe that action, the funny thing, sometimes anxiety paralyzes you and prevents you from taking. All right, so I'm back. For a second there, it looked like I froze. I don't know what happened. But either way, we're back. So I think I was talking about how action defeats anxiety, and um, and about how anxiety makes it hard to sometimes do things, right? Because you're kind of paralyzed. So I have a couple of things for you all that I want you all to pay attention to as it relates to anxiety and how we can manage it, right? And before I get started, keep in mind this is education for educational purposes, right? So this is not medical advice. This is a little generic disclaimer I want to put out there. This is educational information. This is what I would teach the students if I'm back at Augusta University. So take it or leave it. Maybe it'll be helpful, maybe not, but I hope it'll be helpful. That's why we're all here today. So the first thing that I think can be helpful for your anxiety, and I'm gonna put it right here. And Joanna, I appreciate you. I think I froze for a second, but I think I'm good now. Right. The first thing that I want you all to do as it relates to managing your anxiety. Number one is sleep. Number one is sleep. Everything comes back around to sleep. Everything comes back around to sleep, right? And the ironic thing about this is that, depending on the nature of your anxiety, it may be hard for you to sleep. You may be so anxious. You may be having racing thoughts. You may be thinking about tomorrow. And before you know it, it's 1, 2, 3 a.m. and you have to wake up early. And the cycle continues, right? So that's why, when you talk about anxiety, depression, insomnia, these things all go hand in hand. And sometimes when you're struggling in one category, you might be struggling all across the board because that's just the nature of it, right? And let me see. Why is my pops calling? All right, 1 second. Hold on, thought. Oh boy, it's funny. People only want to call me in chat anytime I'm on live. Just making sure that it's not an emergency, right? My personal anxiety is, you get phone calls and I'm like, because sometimes I get anxious. I'm like, should I pick up this phone call? But anyway, so we were talking about insomnia, right? And it looks like Raven says, "Hey, pops." Raven, I'll tell my dad you said what's up. But oh, I was frozen again. You ficky. Anyway, so we were talking about anxiety and sleep. All right. So, all right, we're having some technical difficulties here. Clearly. All right, yo, let me know if y'all can see me, and then I'll resume. I don't know what's going on today, but let me know. Let me see. I want people to let me know in the chat. Tell me if you can see me or not. And this is for people who are watching live, obviously. If you're watching after the fact, I guess it doesn't apply to you. But if you're watching live, please let me know. So Tip is saying I'm good. Tip, I appreciate that. Jocelyn says I see you. I see you. I see you. All right, cool. All right. Let's get back into it. Perfect. All right. So I was talking about anxiety and sleep and about how sometimes if you can't sleep, it could make your anxiety worse. So sleep is the one thing that I think you can take any mental health condition, right? And you can say, take somebody who wasn't sleeping and give them more sleep, right? And, I think they could improve, right? And of course, it doesn't go to everything, right? If you have, let's say you have a typical depression and you're sleeping a lot more and you're eating a lot more, then you wouldn't need more sleep. But for the most part, I'm talking about insomnia here, where you can't sleep and it's cutting into the things you have to do the very next day. So sleep is my very first tip, right? People can hear and see me fine. All right, if you can hear and see me now, I'm good. I'm good. Anna, I appreciate you. Thank you all for being patient. I'm having technical difficulties. I can't even talk. I don't know what's going on. But my Wi-Fi better not trip because I pay a lot of money for it. I don't like waiting. All right, so here's the second tip about managing anxiety. Type it in the chat. I wish there's a fancy way to just put it in there. And all right. So, and Jemiah, I see your comment, but I'm not gonna bring it on the screen. That's hilarious. All right, so the second tip is learn about how anxiety affects you. And this is very important for a couple of different reasons. So the first thing I can think about is triggers, right? So depending on who you are, how anxiety is popping up in your life, and the things that are triggering you, it could be helpful to know, okay, this triggers me, this makes me more anxious, this makes me less anxious, so that way you don't put yourself in situations where you're just like one big ball of anxiety, right? So you want to know what triggers you, and more specifically, you want to know if a certain thing triggers you, how do you manage life? Can you avoid this thing? Is it like social anxiety where like you have to go out and your job forces you to do that and then you're anxious, or look, what type of anxiety do you have? That's why I think it's important when I think you go to a doctor and you get diagnosed with, let's say, OCD. Just give an example. Like, it would be helpful for your doctor to sit you down and say, all right, so based off of my assessment, I want to say that you have OCD and this is how it affects you. These are the thoughts that you're having, and this is the compulsions, and boom, 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 and this is why you're anxious, right? It would be helpful if every clinician did that, and sometimes we don't do that, and I gotta start with myself first. I think I'm pretty good at explaining those things, but you never know. You get caught up, you get busy, you're thinking about three patients down the line. But I think it's helpful if a clinician will sit down there and explain, this is what you're diagnosed with, and this is how it affects you, right? And if you know that a certain situation triggers you, right, or let's say we're talking about PTSD, right? If a certain thing triggers you and is gonna just throw off your day, like, it would be helpful to pick up on that, right? And this is where it helps to have professional help, a therapist, somebody who is also helping you manage life as it relates to your mental health. They can pick up on these tendencies and you can start to learn a little bit more about yourself. Danielle saying, I have anxiety driving. Right. So if you have anxiety driving, how often do you have to drive? Are you an Uber driver, right? Or do you have to commute to work, right? How much does this impact your life, and what can be done over time, right? And a lot of times, if somebody's having a hard time driving, we want to dig deep. Like, well, what's where is this fear coming from? Is it, childhood trauma? Did you get into a car accident, or did you hear something? And then over time, cognitive behavioral therapy, which is this, therapy aimed at helping you reframe things, for lack of a better term. I'm trying to simplify it so everybody can get it. CBT with exposure therapy could be helpful, right? We gradually expose you to the thing that you're having a hard time approaching. And over time, we would hope that you become more comfortable with that thing. All right. And my number 3 tip. Actually, let me read this real quick. I like what Jacqueline's saying. Anxiety is big with me. Triggers from the past, little things like smell, seeing things, and certain things that are said to me that can also cause to increase. So I like what Jacqueline is doing here. So let's say Jacqueline walked into a therapist's office for the first time, and she was just anxious and she didn't know why. Right? You're just always on edge, and you don't know why you're anxious. Right? If after a couple sessions in, Jacqueline is able to tell her therapist this, right? Then we would say, oh, she's made an improvement because she came in not knowing what was going on, and after a while, she's starting to pick up on, okay, boom, 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 this is how this affects me, or that affects me, or this smell, or hearing about a certain thing, or, just, seeing a certain thing can take me back to a certain time and place in my life that I don't want to go back to, right? So just having awareness is super huge. So I like that, Jacqueline. Thank you for sharing. Olivia saying anxiety is running my life at this point. Well, Olivia, hopefully we can, eliminate the anxiety collectively, little by little, right? We would hope. All right. Now, my third tip for dealing with anxiety, it actually kind of matches up with what Sarah is saying here. And like my comment here is like the very next thing below what Sarah said. Sarah says, me leaving the house when I need to meet up with people triggers me, especially going on dates. The worst is a first date. All right. So, Sarah, I mean, this, like no anxiety is like too small, right? Sometimes people like to compare and say, "Oh, this anxiety is like related to like work, or this is just a first date." But it's not just a first date, right? Because that same anxiety may extend when you go on, a work trip and you have to interact with new people, or when you're getting a new job, or if you're meeting somebody in a social setting, right? Because if you struggle talking to somebody on the first date, you may struggle socially in other areas, So knowing this, will allow you to prepare beforehand, and you can't really prepare on if somebody will like you or not, but at least you can manage, things on your end, right? And let me get to my third tip right here, which is socialize, right? And this is another one that is kind of backwards, right? Because if you're anxious, sometimes it may be difficult for you to go out there and socialize, right? You may want to stay to yourself in an environment that you can control, right? If you go into a new social setting, right? Let's say you get invited to a party, like I'm out here in LA, so let's say um I get invited to some party or some event wherever, and I'm not allowed to bring a plus one. So just me going to meet up with, people out there. I could get in that environment, and if I'm anxious, right, it's gonna make me, kind of stay to myself, kind of just like be on my phone, like twiddling your thumb, just kind of like looking around and kind of scoping out the situation, So anxiety can make it difficult to socialize, but by socializing, what you're doing and you don't realize it is you're actually exposing yourself to one of the things that you're afraid of, right? So it's almost like a form of exposure therapy in a sense, right? Like you're afraid or fearful of certain things, and you want to be in control of everything, right? But you don't know what's going to happen when you start to interact with different people. But by trying that, you're dipping into the unknown, right? So you have to give yourself a big clap, right? Like I would want you to give yourself a love of the show, right? Like when somebody comes on here and I like what they're saying, I say, "Oh, I'm going to give you a love of the show." Like you have to give yourself credit for every single small step, right? And the small ones over time is going to be what we lean on as we become that, the most confident version of ourselves. But it's going to be very difficult to do that with anxiety in the picture. Let me look through some people's comments right here. I struggle socializing, but I'm very outgoing and fun. Doesn't make sense on both. Jocelyn, this makes sense to me, right? Obviously, like I come from a professional background, but this makes sense to me. You can be anxious and still be outgoing. It doesn't mean that like you're not anxious. You're just doing it in spite of your anxiety, right? Or if you hang out in certain settings that are familiar to you, but people are new, right? Or vice versa. Like you've kind of prepped for it, so you're leading on to the part that you can control as you like dip your toes into this new situation potentially. And I don't know for real. And Leilani, what's going on? Once you find your tribe and the people who bring you peace, socializing with those people truly helps with anxiety. I agree. I think when you feel comfortable in a situation, because a lot of anxiety is discomfort, right? But it's not the type of discomfort that like you think you can sometimes live with, right? It's uncomfortable enough to the point where it's impacting your life, right? That's why we have, all the anxiety disorders, because it's impacting your life, right? If it wasn't impacting your life, it'd be like just if it was just anxiety, right? Like if you take away all the maladaptive things that come with anxiety, like anxiety will allow you to live longer, right? Because before you cross the street, I say it all the time, like you go look both ways, you just make sure everything is safe, like you want that, but it can get to a point where it can start to take over your life, and we don't want that part. Neil says, would fear of judgment be classified as anxiety? So, Neil, fear of judgment by itself doesn't, get you diagnosed with an anxiety disorder, right? But let's say you're talking about social anxiety. Like within that, you can have the fear of judgment, right? You can be so fearful of rejection that you don't go out, or if you're fearful of what people are saying to you, then after you leave a social interaction, so Neil, you might go to like an event, right? And then, like as you're driving back home, like you're telling yourself, you're like, oh, I think I was weird when I was talking to that one girl. I think, maybe like, my body language, or like maybe the way my feet were. Like you start to analyze how you were in that social situation, right? You think that people may be judging you, right? So we see that. I've seen that a lot, within social anxiety. I hope that answers your question. Crystal says, thanks to you, most of mine is gone. Realizing most of my issues were ADHD because of your videos. Uh, oh, Crystal, I appreciate that. Y'all have me, blushing internally. Obviously, you can't see it, but Crystal, I appreciate that. I gotta give you a love of the show. I live for those comments. I really, really live for those comments. And Cheyenne, all of these lives are saved, so just keep that in mind. All these lives are definitely saved. So, like, if you have to like dip in and dip out, like the live is going to be here. I'm gonna go through a couple more comments, and then I'll give you all 4 and 5. Neil, anytime. Can you talk about anxiety with ADHD? So I feel like I've spoken about this before, but I'll talk about it again. So with ADHD, the way I say it is that like ADHD never really comes to the party by itself. I mean, sometimes you can have somebody with just ADHD, but like for me, like in practice, normally I'll see somebody who has ADHD and something else, ADHD and anxiety, ADHD and depression, ADHD and mood disorder, ADHD and eating disorder. Like ADHD comes with a lot of other things, and anxiety can definitely be one of them. And sometimes just having undiagnosed ADHD and not receiving treatment because you don't have a diagnosis, that experience can be a depressing and an anxious one as well. So sometimes it's like the chicken and the egg, like which came first. Sometimes if a patient has anxiety and ADHD, you're like, were they anxious first, or was the ADHD the main thing where that's where the anxiety is stemming from, right? Um, and Neil, I appreciate you. Thank you very much. Let me see. Mothers with no support system that can't. Oh, yeah. Look, parents in general, I think, we probably see more of the single mothers and single fathers, right? But yeah, parents in general, and especially mothers, without a support system, that can make you feel like you're drowning, right? So wherever you are, and then whatever help you're able to kind of like latch on to, like no help is like insignificant. I would say anything that you can get, like please lean onto that. Take it day by day. Kebra. It's a nice name. Um, I never feel coming. Well, all right. This is once again where I think I don't know if this is anxiety related, but just having people around you. Obviously professional help, but people who allow you to feel that tell you the truth, right? Because the truth is everybody has some worth and some value to them, but depending on what type of things your brain is telling you, it can be really difficult. Um, Let me see. Hey, Kevin. Well, Kevin is this week. It's Wednesday. It's Wednesday. Let me drop in the fourth one, the fourth tidbit for you all. All right. So the fourth one right here is I want you all to evaluate your relationships with alcohol and substances. Right. and right there. Evaluate your relationships with alcohol and substances, right? So this is the thing about anxiety. A lot of times, and I realized this recently, or maybe within the past 2 or 3 years. When I was posting, my videos on TikTok originally, and I would talk about, oh, this anxiety could look like this, or anxiety could look like that. When I realized that a lot of people did not know what anxiety looked like or what it could look like, then it started to kind of click for me. I was like, oh, so people don't know what anxiety looks like. So when they're feeling anxious, right, they will call it something else, and if you're not careful, you'll just kind of start to like self-medicate, or you'll kind of play your own doctor. And I don't blame people for this. I think we should educate people, and come from a non-judgmental perspective. But if you don't know what's going on, but you just kind of feel like somebody mentioned in the chat earlier, like, oh, I can't really sleep, or like if you realize that something is going on and you're having a hard time like sleeping at night, but you realize that, oh, I have a couple glasses of wine, and I'm able to sleep good, then that might be your go-to, right? And then it might become a thing, and before you know it, that becomes like an every night thing, and you might start to drink more, right? Or people say, oh, I can't fully sleep unless I smoke, or I take an edible or something along the lines of, and I'm not saying that you should or shouldn't do that, but if like you ever feel like you're dependent on a certain thing to sleep or to function, or just to manage your anxiety, I think that's a good time to just kind of like reevaluate your relationship with that thing or substance or whatever it is, and just kind of ask yourself, like, is this thing helping me? Is it hurting me? And keep in mind that if you started with this habit, or whatever substance, right, it helped in the beginning. People don't realize that, like, that thing helped in the beginning. Otherwise, you would not have kept doing that thing for weeks and months on end. So it's okay to realize, okay, this thing helped me, but it helped me because I was feeling X, Y, and Z. And then if you're like, oh, it's anxiety, you're like, oh, okay. So I was anxious, and that's why I decided to self medicate. So now you have half of the battle won. And then now that you know that it's anxiety, try to get to the root of the anxiety, and then you can work it out with a professional. And now we're like back on track, like for real, for real. So just evaluate your relationships with alcohol and substances. But I'm not saying to quit or whatever. But just kind of have that in the back of your head, like, is this helping me? Is it hurting me? I think just thinking about that is like, that's all I want y'all to take from this. Just think about it, right? Just think about it. When I can sometimes call anxiety to see where Mark, yeah, Mark, I agree with you, and that's why I'm saying, once again, it affects people differently. So we can only go with what we have, when it comes to evidence-based information. So that's my way of saying that, like, if you self-medicate, like, you're kind of on your own, because you're playing your own doctor, but you're not on your own because, like, you always, well, I would hope that you have like a provider, or a clinician in the area who's not going to judge you. But at least for me, like, if I'm practicing and somebody is, taking whatever substance, like, whatever it is, like, I just don't judge, and I recognize that they took it for a reason to help them with a certain thing. And then, in my head, I'm thinking to myself, like, hopefully, what if whatever I give you does, you know like 80% of whatever you get from this substance. And hopefully, it tells me that we're on the right track. So maybe we do some dosage adjustments, figure out what to do with that medication, boom, boom, boom. And then over time, I can assess and see, okay, like, do you want to stop? Do you want to cut back on drinking? Do you want to cut back on blah, blah, blah? And if the patient's like, yes, then we'll do that. If they say no, then we'll leave it alone. And then we continue to help them out as best as possible. And we just keep going from there, right? Just keep going from there. Um, Personal day from work. I think this depends on where you're at, Kendra. But I think, like, in Illinois, I know that they came out. Well, I'm not sure, but I was hearing that there was a state. I'm thinking Illinois, where they were talking about letting kids have like a mental health day. Like, I'm not sure, so like I don't want to spread misinformation, but like I've read about that. I'm not sure though. I've read about that. And Tip says this video's Tip. The goal of this video is not to make you anxious at all, but I think what could be happening is we might be confronting the feelings of anxiety, right? And thinking about managing your anxiety could make you anxious, right? So that might be what's going on. Um, Jacqueline says we'll be celebrating 60. So this is where we give somebody a love of the show. Let's go ahead and congratulate Jacqueline in the comment section. This little thing where I blow in my hands, I just kind of came up with it recently. I like it though. Congratulations though. Congratulations. And are they any non-benzo? Oh yeah, Richard. And this is why I'm such a fan of people going to like a clinician, because they'll tell you about them. I mean, I'll tell you right now because you asked me. But like, you go to a doctor and they can put you, get you up to speed on these things. Non-benzo anxiety medicine. A lot of times we'll start for the antidepressant, right, which is a like an SSRI, something like a Zoloft, Prozac, Lexapro. Those things, work good for anxiety. We can do medications like, Vistaro, which is not a benzo, helps for anxiety. What else? Buspar. That was definitely one of my go-tos when I was working in forensic psychiatry. So there's definitely so many options, and Richard, I don't know how other people do it, but I never start off with a benzo first. Like, that's not how I was taught in school by the OGs. But there's definitely options for you. So keep that in mind. Um, Let me see. Kendra was. Okay. All right. Like, I appreciate that, because I was like, what's going on? All right. And let me see. I'm a caregiver. My client will help you stop giving anxiety. So, Angela, oh, I think you might be realizing that, fortunately or unfortunately, we only control ourselves, right? So, sometimes, well, all the time. I mean, there's nothing you can really do to, like, help somebody help themselves. I mean, you can put somebody in a better position to help themselves, but you can't, like, how do I say, like, you can't, the thing that you want them to do, you can't make them do it. And it's very difficult. I remember, quick story, and I'll get to point number 5. But I remember back when I was in school, and I was training at the hospital, and I talked to, like, I was talking to the psychiatrist who was running that unit, and I asked him, I said, how do we know if a patient is ready to go home? Like, how do I know that this patient is ready to leave the psychiatric hospital, right? Or what if we think that the patient is ready, right? And the patient goes home, and the patient does something to maybe somebody else or themselves, right? Like, how do we, like, manage that, right? And as I was asking, the psychiatrist a question, like, the whole time, like, I'm, of course, like, I'm still in school trying to figure out how I would approach this situation, when I get to be the shot caller one day. But he was like, Kojo, we're not, we don't read minds. We're not detectives. We do the best that we can to make sure that somebody's ready to leave the hospital, and then we equip them with all the tools. And then once we feel like we've done the best that we could, we do that, and then we just make sure that they, follow up with their aftercare appointments, and that they stay on, track with that. But you can't, like, when the patient goes home, we can't follow you in the camera and be like, are you taking your medications? Are you going for your lab draws? We can't do that. But me just being so anxious, I was like, are they going to be okay? But you can't control the other person, right? So we do the best that we can, and we hope that that's enough, right? And we try and put people in positions to succeed. Let me see other videos. Michelle, I appreciate that. Thank you so much for that comment. And Christopher says, I take breathing exercises. Sit down in the middle of the room. Think of just one thing you want to get done. Don't get up. Tell yourself you feel ready. Then get that one thing done. Start small. Oh, Christopher, I like this. I like this. So you're starting small. Okay. No, I really, really like this. This is dope. And I know diaphragmatic breathing, like using your whole chest to breathe, could be helpful as well. And then my last tip right here, all right, is I want you all to validate your feelings. Um, let me answer. Let me answer these two questions real quick, and then I'll talk about that because I want to make sure I can get to you all's questions. So, what can you say about anxiety, PTSD, dissociation caused by induced by psychedelic drugs used in the past? Sorry for repeating. All right, so real quick for this, Dennis, it depends. Like when there's like let's say heavy substance use, sometimes that can change like how your brain is wired, right? So this is where you bring the patient, if the patient at the hospital already, you talk to them, you evaluate them, you test them out, check their cognition and see, hopefully their cognition is still like decent to where they can function and think. But sometimes substances can can change you, like, and sometimes the damage is irreversible. Like if we're being like honest here, I'll never lie to y'all. But hopefully, we would hope that that the damage is not irreversible. And I think right here, like, it's pretty a good first step. Make sure that they're good. Number two, evaluate, does that person want to keep using in the future? If so, how much, or do we want to cut it down? And then number three, I would say we have the anxiety and the PTSD and the dissociation in the present. How do we fix that, right? So we're talking about all the factors, but how do we fix the anxiety in the current moment, right? And we can do talk therapy. Like, we can give you a pill for it too, but we want to get to the root of the issue. But if we know that the root of the issue is caused by the substances, then we would remove the substances and just treat the anxiety that's like left over, right? Or that's what I would do. Like, if I would explain what I would do in this situation to a student, that's how I would answer it. My anxiety has affected my life, my marriage, everything. Is there anything that won't cause weight gain? Yeah, right. So once again, when you go to the clinician's office, you can talk about the different options, right? And if one antidepressant is not helpful, you can switch to another. You can switch to something like Visceral. I think the things that really cause weight gain, at least from what I've seen, are like the antipsychotics, right? So if I don't know if maybe somebody is, I hate like Seroquel. Sometimes we use that for anxiety, right? We know that that can help cause people to gain weight. But still, like, if your doctor's recommended it, like your clinician knows exactly why they recommended the thing that they recommended to you, if that makes sense. All right. Sorry, I got sidetracked answering these questions. My bad. All right. So number five, validate your feelings, right? Like, if you're having anxiety, sometimes, like, once you realize that you're anxious, you may become frustrated, right, at yourself because you're not as productive. You're not able to do things, and you're just stuck thinking and then overthinking, and then you feel like you're wrapped up in your thoughts. So I want you to validate your feelings and understand that, okay, for whatever reason, I'm anxious right now, and it's okay that this is where I am right now, and I'm gonna push through it, right? But we don't want you to be anxious forever, but it's okay to recognize, all right, I'm anxious right now, and I'm gonna push through it, right? Because if, let's say, you were hanging out with a friend, right, and they're having a panic attack, or they're feeling extremely anxious for whatever reason, right? A good thing to do is to like help validate them, ground them, right? Talk about the grounding techniques, validate them, let them be where they are, right? And don't let them, I hate using the word crazy, but don't let them feel like they're crazy, for lack of a better term. Y'all get what I'm saying. Don't let them feel like they're having, like, they're not like the rest of us, because like, anxiety is something that anybody can feel, right? So you would validate them, right, and then stay with them and let them know, okay, I'm here with you. So the same way you'll do that for somebody else, do that for yourself, if that makes sense. I hope it makes sense. Let me know if it doesn't make sense, right? Because I need y'all to get this, so that way you're getting something from it, right? So validate yourself as if you were helping yourself get through, like, a panic attack or anxiety attack, for lack of a better term, right? And I think that'll be a good thing to help you, because the thing with mental illness is, because like we're just now starting to talk about it, if you don't validate yourself, you're gonna feel like you're some weird human being, right? And we all want to be accepted in some capacity. So if you think that you're some weird human being, and like you're the only one having these weird feelings and nobody else thinks about the future like this, and like, it's not good. Like, you don't want to feel that way. You don't want to feel like you're alone in your suffering, right? So that's why it's very important to validate your feelings. And let me read through a couple more of these comments on the side. I crochet. I take my crocheting. Yeah, it's helpful to have an activity that you like to do, that you could that could help you start small. Let me see. Many people warn me don't get medicine for antidepressants because it was unsuccessful for them and it didn't sit as well with me too. What should I do? So Jenny, I mean, Dr. Kocher can't really tell you what to do, but like if you were a friend, I would go back and well, you are a friend, right? You're part of this online family. What I would say is go back to your clinician and let them know that hey, I took X, Y, and Z antidepressant and it didn't work for me, and I'm a little bit afraid to take something else because this didn't work for me and because other people have told me that this thing doesn't work well for them, right? Now I know that certain drugs work for people and it works really well and it might not work for other people, right? But if this has been your experience, you might be thinking to yourself like, oh, like none of these medications will work, right? But I would at least want you to have enough hope to where you can go and book that appointment, because I mean, like, I don't know what you've taken, but and obviously this is not the platform to be asking you that, but assuming you haven't taken like all of the psychiatric meds that we have, you can go back to your provider and they'll say, okay, so we tried these two or whatever, boom, 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 it didn't work, so let's switch over to this, right? And then we have our own little algorithms within our head as to what we would try next, or at least for me, like if I'm sitting down there with a patient and I prescribe Visceral or just throw something out. If that doesn't work, in the back of my head, I'm like, all right, bet if this doesn't work, like that's just me. I always have like a backup plan to the backup plan, and you hate to get there, but then like you always have to think that this person can get better. Because if you don't think that, then you might as well just quit your job, right? You might as well just quit your job, you know. Yay! Leilani, appreciate you. Look at my time. Okay, yeah. Oh, Mickey Ficky. Yeah. Well, somebody go ahead and drop the magic word. And let me read one, two more comments real quick. There's so many. Oh, yeah. Rebecca, in terms of meds, there's so many options. Jessica, I appreciate you. Let me see. Crocheting. Y'all crochet? I feel like I would hurt myself trying to crochet. It's crocheting where I'm trying to think of crocheting without googling it. What's the difference between crocheting and knitting? Before we do the water break, what's the difference between crocheting and knitting? Like I know y'all know, so somebody help me out. Before cheers, 1 second. It uses a hook. Okay, it uses a hook instead of Wait, what do you mean? What's a hook? Crochet is the hook. Knitting is with two needles. Crochet. What are y'all talking about? Crochet. Crochet has a hook, one hook needle, rather than two straight ones. Crochet is one needle. Knitting is two. Crochet is this is too much for me. Knitting uses two needles, and crochet uses a hook. Yeah, Brittany, yeah, you're right. It's over my head. You know what I'm gonna do? In true ADHD fashion, I'm gonna tell myself that I'm gonna sleep early tonight so that way I can hit the gym early in the morning, like I did this morning. And then at 1 a.m., I'm probably gonna be watching a YouTube video that is trying to explain the difference between crocheting and knitting. And I'll probably watch that whole 20-minute YouTube video and become an expert. And then be behind. Okay, all right, yeah. So this is over my head. This is over my head. Knitting is. I don't know where you all even store these thoughts. This is way beyond like my comprehension. See, I don't know everything. The things that I know, I'll talk about it, but you'll never see me have a live on crocheting and knitting. But I'll watch that YouTube video and I'll get back to y'all. You wrap the yarn around the crochet. All right, okay. Somebody drop the magic word and then we'll get the cheers. Let me answer this real quick. My wife gets effective. How you help a spouse with mental health issues? So Sage, real quick before the water break, I think it can get tricky when you have a spouse, and let's say you married them and you weren't aware of their mental health issues because you're not sure how to help, right? So the first thing that I like to do is ask them like how they like to be helped, right? And then just be observant. If you notice that they struggle with a certain thing, you stepping in to do something for them can go a long way, right? Because one mental illness like is really, really like kicking your ass for real, it's hard to do anything and be productive, right? So you stepping in to do something small could go a long way, Sage. All right, let me see. Cheers. Somebody dropped cheers in there. Natasha, I appreciate that. I have a lot of love for y'all too. Even though I don't know how to crochet and knit. So it's the same thing. One is using an extra tool. Michael, see when Michael put it that way. What? See, Michael, I don't know what is what, but one uses the extra tool. Okay, so I got some homework to do. All right. Anybody gonna drop? There we go. We got the magic word in. All right, y'all. Cheers. Yeah. Ooh. Oh boy. So that was a good live. That was great. I like these lives where, like 5 practical tips for boom, 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 or and I'm always looking for like, you know, different like. I'm just looking for like a way to like do like a concise live or presentation and talk about certain things. So when I say 5 tips on this or that or boom boom boom, I like those style of videos because I think somebody who really wants to just learn about anxiety, or ADHD or wherever the next thing is, they can just like tune into that live and then I'll go back through on the back end and look at some of the comments to see if like it's effective or if people like it or if they don't like it. Boom boom boom. So all right, that is let me see things I try to help as much as I. Yeah, Sage, look, just by being there for your spouse who's struggling, and look, honestly, just by asking this question, it shows that you care, right? And sometimes like we care, but if we don't like follow through and do something to show that like we care and we're present, your spouse might think that like you don't care, right? And you're just kind of like, letting them suffer, right? But just by asking that question, I can tell that you definitely want your spouse to do better. So I feel like you're already on the right track. You just have to, keep going. So all right. And Stephanie, I appreciate you. Thank you so much. Thank you, Stephanie. Uh that's Stephanie like I know you, but I appreciate that, Stephanie. So I do have to. Oh yeah, 10 minutes over. I do have to dip out, but I appreciate you all. I'll be back on tomorrow, and I have just there's something cool that we're gonna be doing, but I have to talk to the team and make sure that we can announce it before I start running my mouth because I can't really keep a secret. But I'll talk to the team and then whenever I can announce I'll let you all know where I'll let you all know. But before I before I get out of here, one last love of the show for Libby. She says I did a good clean in the kitchen. I give it to you. It's hard to clean. I tip my Titans hat off to you. So congrats on doing that. I gotta. Speaking of organizing some stuff, I got my friends coming to crash here. So I gotta do some folding. Myself. All right, but I'll see you all tomorrow. I appreciate you all, and keep going. And of course, like as y'all always do, I don't have to tell y'all to do it, but keep leaving comments on the live videos. Let me know what you like, what you don't like, and then I can craft this thing into the best version of what it needs to be. So until next time, you all take care.